Persons with mental health challenges face discrimination, stigmatization, isolation, and exclusion from society, with little attention and priority given to their needs. Nevertheless, the National Human Rights Commission, in its mandate to ensure that the human rights of all citizens, including those living with mental health challenges, are respected and protected, organized the two-day National Stakeholders Dialogue on Mental Health Rights in the Gambia. The ongoing convergence, anchored on the theme, "There is no health without mental health," aligns with the NHRC's efforts to foster a culture of human rights in the Gambia, leaving no one behind. This dialogue aims to facilitate the exchange of ideas and advocate for the development of laws and policies that integrate mental health into the national development agenda.
We as the National Human Rights Commission firmly believe that addressing mental health challenges requires a collaborative effort, and this can effectively be done by bringing together, as we have done, stakeholders from diverse sectors to explore innovative solutions and chart a way forward. For far too long, mental health has been at the margins of our national discourse. The lack of public dialogue, inadequate policies, and insufficient support systems for those affected have hampered progress in advancing mental health literacy, providing services, and developing appropriate laws and policies in the Gambia.
The Executive Director of Action Aid International, the Gambia, Ndela Faikoli, called on the government to align the mental health bill with human rights frameworks.
Really, if the recovery-focused National Development Plan, the SDGs, and all other national and international frameworks are to be achieved without leaving no one behind, then mental health in all its facets have to be improved, implemented, and monitored to improve access in all parts of the country. We really want the government to push for the mental health policy and bill to be aligned to the human rights frameworks, finalized and sent to Cabinet and Parliament for approval as soon as possible to improve the policy and legal framework for mental health. We also want to request the government to prioritize mental health service delivery and increase budgetary allocation to cater for the training and material needs of mental health services for improved quality delivery. We always are being reminded that we don't have enough, but in the midst of inadequacy, prioritization can do a lot.
The UN Resident Coordinator, Carl Frederick Paul, stated that progress on improving mental health remains inadequate globally.
Mental health as the right to health is a fundamental human right linked to obligations under human rights instruments such as the Universal Declaration of Human Rights, and also the International Covenant on Economic, Social, and Cultural Rights. At the global level, progress on improving mental health in many countries remain inadequate and may violate human rights standards, and the Gambia is no exception.
Highlighting the timeliness of the convergence, Vice President Mohamed B.S. Jallow said,
"This national dialogue on mental health is both timely and crucial, offering an opportunity to raise awareness, reduce stigma, and recommend effective strategies for improving mental health services and tackling drug abuse. Ongoing reforms, such as the constitution-making process and the drafting of the mental health bill, provide opportunities to strengthen domestic legislation, protect the rights of people living with mental health conditions, and enable equitable access to services."
Previous speakers at the event called on the government of the Gambia to support the country's only psychiatric hospital. Vice President Mohamed B.S. Jallow responded,
"I also want to take this opportunity, as has been mentioned by two speakers earlier on, to confirm, as the DPS has mentioned, that during the budget discussions of this year at Cabinet, Cabinet has taken the decision to upgrade the Tanka to make sure that it's a separate institution from the Edward Francis Small Teaching Hospital, so that it can attract funding and specialization also. Thank you for this opportunity, and take the opportunity also to declare this open.
The participants will be enlightened on the synopsis of the global mental health situation, a situational analysis of mental health in the Gambia, mental health in workplaces, as well as substance use and its impact on mental health. Reporting for the Falter Network, Mama A. Toure.